Today we're talking about stereotactic breast biopsy. If you have questions, you can send them to the doctors at WLBT.com. Joining us now is Donna Lustig with Baptist Health Systems. Thank you so much for joining us.
You're welcome.
One thing about mammograms is they say you end up having a lot of breast biopsies that you probably don't need. With this stereotactic system, is that a problem other than cost?
Actually, it's improved the number of patients that have to go to surgery. We still do a good many breast biopsies. We don't do as many as we used to because of the quality of mammography. And with digital mammography, it allows the radiologist to be much more selective about who needs a biopsy and who does not. But the stereotactic has saved hundreds of thousands of women every year from going to the operating room and being put to sleep and having to have a wide, what we call a wide excision biopsy.
Well, would you explain this whole stereotactic biopsy briefly for us?
Sure. It uses X-ray to find a lesion that has been identified on a mammogram. The patient is awake. They're given a local anesthetic very similar to what they use at the dentist office and placed on a special table, and we try to duplicate the mammogram using X-ray to find the area of suspicion. Once we're satisfied that we've duplicated that and found that area, we put a special needle into the breast that lets us take little pieces of tissue out. Most patients do not complain of pain. We give, like I said, we give them a certain amount of Novocaine, and we tell them as we go along, if you feel pain, tell us, and we can give you some more Novocaine through the biopsy needle. The actual biopsy itself probably takes less than 12 minutes. We X-ray the tissue to make sure that we've got the area of interest there to go to the lab, and then we pull the needle out and hold pressure to make sure the patient's not going to bleed. There's no stitches, no incision. We send them home with a little bandage and an ice pack, tell them to take it easy for the rest of the afternoon, and the next day they can resume their normal activities.
Now, when you're talking about basically recreating the X-ray, recreating the normal mammogram.
Right.
How do you do that? You're laying them down on the table.
They're laying down on a table.
On their stomach.
On their stomach.
Okay.
There's a hole cut in the top of the table. Their breast drops down through that hole. Under the table is mammogram equipment, and we position their breast just like they were positioned when they had their mammograms done.
I guess you can kind of think of it like when you go and have a massage done on your back, and when you lay down on your stomach,
exactly.
And how they have a little hole there for your face to drop in. Okay, similar to the same
It's exactly the same principle. Okay. And it lets us recreate that mammogram because we always have the mammograms there at the time of the biopsy, so we can compare what we see on the computer screen to what the mammogram looked like.
Wow.
That's interesting.
As it sounds
so instead of standing, you're laying down.
That's right.
I mean, it sounds like really neat technology.
It's very interesting technology. We've been doing it at Baptist since 1997. We first started doing them. We do hundreds a year, 200 to 300 patients a year. And it's amazing. It really is. And patients walk out, they're not sedated. We don't give them any mood-altering drugs of any kind. Most ladies tolerate it extremely well. And there are very, very few side effects. And we have 97% accuracy of getting what we go after.
That's great. You're going to be accredited soon, or have been accredited for this program now?
We've just passed voluntary accreditation by the American College of Radiology, and they look at our technologists, our radiologists, and the radiologists are the ones that actually do the biopsy at our facility. And they look at our equipment. We have to send them copies of cases that we've done, and it's done by a review of staff radiologists at the American College of Radiology in Virginia. And so it's an accreditation for 3 years, and you have to reapply. It's not good forever. And we're real proud of that.
I bet you are. Well, it sounds like really neat technology. I mean, you know, breast health is so important for women, and you don't want to have to undergo those surgeries. You don't have to.
That's right. If we can avoid being put to sleep for something that can give us the same diagnosis, and this also helps women because when they have a diagnosis, the surgeon already can plan ahead of time and not have to go through what women went through years ago when they went to sleep for a biopsy and they woke up without a breast. And that doesn't happen anymore.
That's great. Donna Lustig, Baptist Health Systems, thank you so much.
You're so welcome.
And for more health news, log on to our website, WLBT.com, and click on Medical Matters.